We're getting a clearer picture tonight of the nurse infected with Ebola and the fallout for hospitals nationwide.
26-year-old Nina Pham treated Thomas Duncan at a Texas hospital. She is now in isolation, and today her family admits they are scared.
CBS 2's Hazel Sanchez begins our team coverage with that and more on how the government is responding. Hazel?
Christine and Maurice, the CDC says it is stepping up education and training for healthcare workers after Dallas nurse Nina Pham contracted the Ebola virus while caring for a Liberian man who died from the disease last week. Pham's father says she's in fine spirits and is in stable condition, only suffering from a fever, but she, along with hospital officials, have no idea how she became infected.
We have to rethink the way we address Ebola infection control, because even a single infection is unacceptable.
The Centers for Disease Control still doesn't know how a Texas Health Presbyterian nurse contracted the Ebola virus, despite the hospital's strict safety protocol. 26-year-old Nina Pham was wearing full personal protective equipment during multiple visits with Ebola patient Thomas Duncan, who died Wednesday. 2 days later, Pham developed a fever and tested positive for the potentially deadly disease.
There was a breach in protocol, and that breach in protocol resulted in this infection.
CDC Director Dr. Thomas Frieden suspects the nurse may have touched contaminated protective gear. Hospital officials are trying to pinpoint when that lapse may have occurred and how many other people will need to be monitored 21 days for possible exposure. The CDC is now reevaluating protocols for using protective gear and limiting the number of healthcare workers who have contact with Ebola patients.
A breach in protocol may be that the protocol's fine, they were not trained properly.
If this one individual was infected, and we don't know how, within the isolation unit, then it is possible that other individuals could have been infected as well.
Hazmat crews spent hours cleaning Pham's Dallas apartment. Her husband has also been placed in hospital isolation to be observed for possible exposure. Her neighbors are nervous.
I'm definitely going to be taking more precautions. It's something that's very scary. It's creepy that it's just a few houses down.
2 Boston hospitals and a hospital in Jacksonville, Florida, were on high alert after treating patients who had traveled to or had contact with someone who had traveled to West Africa, where Ebola is widespread. The patients had flu-like symptoms, but in both cases, health officials determined the patients were not at high risk for the disease.
Of the 6 Ebola patients treated in the U.S. before Nina Pham, Thomas Duncan was the only one not treated in one of 4 hospitals around the country with a specialized unit set up to deal with high-risk germs. The CDC's director says he is now considering moving all Ebola patients to those specialized hospitals to improve safety and minimize risk. Christine and Maurice?
Okay, thank you, Hazel.